So in the new patient process, our goal is to listen to the patient's desires and goals. And if the patient has really any desire for a change in their smile, or if they, in a perfect world, maybe they would want to look like this celebrity, or they would want to look like themselves when they were younger. So we want to start that dialogue, right then and there. And we do that by starting with a mock-up, an aesthetic mock-up. And basically it's a picture that we take of the patient, and then that picture is sort of converted by a technician that we work with who can help us, with starting to develop a smile design, and so when it comes to, what restorations or what we end up doing to get to that result, it just depends on, the patient's desires once they see that mock-up. Is this possible? Yes, it is possible. Let's talk about how we can get there. And it can be something as simple as whitening. And fortunately, there's lots of different options when it comes to whitening teeth, and then even more so, getting into things like veneers and crowns, and if there's a missing tooth, that obviously we consider that aesthetic because most teeth are visible when you smile. That sometimes the conversation about replacing a missing tooth all of a sudden comes into the fold, which also is a large discussion in comparing implants and bridges and partials and things like that. So, I think cosmetic dentistry can mean a lot of different things from the standpoint of restorations, but the bottom line is listening to the patient and understanding sort of what that patient wants from a visible or a smile perspective. That's the ultimate goal, is getting to that desired look, and helping that patient with their confidence.